Hi everybody, welcome to week 7 of your practicum course. I hope your week has been going well. This week our topic is participate in curriculum design and evaluation of program outcomes. Okay, yes, I am kind of an education geek. I love this topic. I have been involved in setting up new curriculums for nursing programs, revising nursing courses, and very much evaluating program outcomes. And if you end up being on the academia side as a faculty of working in an accredited program, you will be involved in all these things. As a nursing instructor in the clinical setting, you'll be involved in revising things like nursing orientation, implementing new standards from accreditors, working with new equipment and having to develop some sort of teaching. From the patient education perspective, maybe your docs have changed the way that they treat a certain diagnosis. Maybe there's a new surgical procedure that patients need to be taught. We now have inhaled insulins that we're starting to work with, and those are going to need to be taught about. So regardless of the area that you choose to focus on as a nurse educator, curriculum design, evaluation of program outcomes are all going to be very important. That does bring us to the question, though, of what is curriculum? Is it the objectives for the course? Is it the readings you assign? Is it your lectures and class activities? Is it the social norms that we're trying to instill? There's all sorts of ways to think about what is curriculum. I'm going to be attaching 7 school curriculum types, and it lists out different perspectives on curriculum, different types of curriculum. I want you to take a look at that. I think we sometimes have a very narrow focus of what curriculum is, and it's actually pretty broad. All right, so we'll be talking about that this week. And in curriculum design, one of the big trends right now in nursing education is moving from a traditional curriculum where you had foundations, Med-Surg 1, Med-Surg 2, OB, Ped, Psych, to moving to concept-based curriculum. In concept-based curriculum, we take a particular concept and look at it across the developmental spectrum. So let's say we're focusing on respiratory, gas exchange. We're going to talk about, okay, what is normal physiology in gas exchange and respiration, ventilation? What are some of the pathological changes that can happen? How do we, in general, take care of a patient who has respiratory issues? And what things are different in the neonate, the pediatric patient, the young adult, middle adulthood, geriatrics, and we discuss that respiratory component across the spectrum. Then there's other concepts like ethics, professionalism, cardiac, all sorts of things. But you look at them across a spectrum, and the idea is to get students to think more in a critical thinking mode about general concepts that we use in care rather than memorizing every single respiratory disease out there. We get them to think about respiratory in general. What do I do for a respiratory patient? And then if there's something that comes up that I've never heard of, I can look over that minor change but know that I'm providing good care for a respiratory patient. It's a big change in concept. But I am attaching, what am I attaching? I'm attaching ways to organized concepts, just some information about that, and evaluating concept-based curriculum. I'm putting some information in about that so you can understand a little bit about this trend. What we were finding in traditional nursing education is that as new stuff came along, you just added more and more and more and more, and your curriculum just exploded. It's just way too much for a student to try to digest and memorize and spit back out. we want them more, there's certain things you have to know about the basics, but we want our students to be able to critically think through what's happening in this patient's body and mind, and how can I approach that so that I can provide safe patient care. So that'll be a lot of our discussion this week about curriculum design. And we will also be talking about program outcomes, because your program outcomes are going to be different depending on what your program is, right? If you're in academia, clinical education, or patient education. So we'll be talking about those also. This week, the assignment is the midterm evaluation. And like I think I've mentioned before, if you started your practicum at the very beginning of the course, then yes, it's time to do your midterm evaluation. If you started your practicum later, then you're going to be asking your preceptor to fill out that midterm evaluation when you're about halfway through those 150 hours. And then, so you won't be uploading anything now. You'll be doing that when you're about halfway through your hours, okay? And let's see. Oh, I also had some questions about the NEPD and like, what do you do when you finish your practicum but there's still NEPDs due? So you have to submit an NEPD in order to get points for it. So let's say you've finished up your practicum and there's still 1 or 2 weeks left. You're going to go down to that next session and fill out the student comments piece, just telling me a little bit more about things that happened during your practicum that maybe you haven't told me about yet. Also, if you do finish your practicum up pretty early in the course, you do want to look at the assignments for the last 2 weeks, because it has like your final course evaluation, your evaluation of your preceptor's evaluation of you. There's a few different things in there that you'll want to make sure that you get filled out, especially while you're still in contact with your preceptor. Okay, I think that's about it for school stuff this week. I'm coming to you today from my family room because it's really hot outside. You'll see I have my Vacation Bible School t-shirt on. Tonight is the last night of Vacation Bible School at my church, and I have been working for about a week now, with a group of 5- and 6-year-old little boys who are quite rambunctious, but they're really adorable. So tonight's my last night with them. All right, I think that's about it. I'll see you in the main forum.